Hi, I'm Dr. Greg Anzaba. Today I'd like to discuss a condition called anemia. Anemia is where your red blood cells or hemoglobin, which is part of your blood count, is lower than what it should be. Hemoglobin and red blood cells carry oxygen to the tissues that is vital for life. So there's mild forms of anemia and there's severe anemia, and the symptoms vary. Mild anemia, a patient may not feel anything. The blood count may be a little bit low, but in severe cases, they can feel extremely tired, fatigued, short of breath, pale, chest pain. So it's something to be taken seriously and should be checked regularly. So what causes anemia? There are several types of anemia. There's iron deficiency anemia, which is typically related to blood loss, maybe a gastrointestinal bleed, a colon polyp that can be very slow to detect, but it can eventually become significant. There's other types of anemia, such as nutrient deficient, like vitamin B deficient anemia. There's other ones, autoimmune, like hemolytic anemia. There's anemia of chronic disease, such as chronic kidney disease or inflammatory anemia from rheumatoid arthritis or other autoimmune processes. So how do we navigate this? It's important that your primary care physician check the CBC, complete blood count, to see if you're anemic or not. And then based on the numbers, they can figure out what type of anemia it is. So how do we treat it? Well, it kind of depends. If you've got significant blood loss, a patient might need iron infusions or a blood transfusion and figure out why they're losing blood. Some people lose blood, like we mentioned, through a gastrointestinal bleed. Some young ladies lose it through menstrual causes, and some can be traumatic, like a wreck or a surgery. Nutrient deficient ones require a proper diet and sometimes B12 and folate supplementation. The autoimmune ones also require a different treatment. It depends on what the inflammatory process is. So to kind of summarize anemia, there are several types, and there can be several symptoms from mild to severe. It's important to check all these parameters out, especially if a person is not feeling well. I hope this helps clarify the different types of anemia. For more information, please refer to my website. Thank you.